Good afternoon and welcome. Thank you so much for joining us. You have Janie here with the Village Resource Radio, 107.5 FM. It is a pleasure community. It is the third Thursday of the month. You know what that means. We have Ask the Doctor. And it is an honor and it is a great privilege to introduce to you all Dr. Bracero. Ms. Bracero, she's going to talk with us about
flu vaccine and the importance of receiving a flu vaccine. Hi there. Thank you so much for having me. I'm Marisa Bracero. I'm the clinical administrator for the Grace Women and Children's location and Lincoln Park location at Florida Community Health. So thank you so much for having me.
It's a pleasure. So what should I know about the flu vaccine?
Well, as you know, influenza is a virus that goes around every winter. It can make people very sick. People who have the flu tend to have like very high fever. They feel terrible, body ache, sore throat. It's very contagious. Influenza was responsible. I had to look it up last night. Up to 80 million people last year alone were sick from the flu. And they're still gathering all the data, but about 130,000 people died from influenza last year.
Oh my, these are large numbers. I think we sometimes don't take into consideration how many people it actually impacts. Like if it's not us, we didn't realize those numbers.
Correct. And of course, there's some people in our population that are a little bit more vulnerable to influenza. People over 65, babies under 2. People with immune deficiencies, such as people with cancer, HIV, lupus, are on medication that make their immune system weaker. Correct. And so that's why flu vaccine is important for everyone, but especially for those in those populations.
So let me ask you this. What would you say to the individual that is like anti-vax, the level of importance and how to combat that, I don't want to say that narrative, that level of lack of information? Some folks just don't have the information to even consider.
Right. I know right now it is a very confusing time with vaccines because whether you get your information on the news or social media or friends, family, there's a lot of conflicting information. We actually have over 200 years worth of science supporting vaccines, showing how they're effective, showing how they're safe. The flu vaccine is unique in that it's different every year. So I think that's why some people are like, oh, I got that before. What do I need to get it again? But as we've learned since COVID, we know the viruses change. They mutate, they change, and they get different. And so that's why you need a vaccine every year, because actually the flu vaccine itself changes every year based on what they think is going to make people sick that year. So sometimes the scientists get it right, and sometimes it's not as good as we had hoped, but it still makes your immune system create antibodies or memory so that if you get exposed to the flu, you may get sick, but maybe you don't have 104 fever for 5 days. Maybe you're not laying in bed with the worst headache, and maybe you just have what feels like a little bit of a cold and a scratchy throat versus someone who gets really sick. And that's why it's so important. Also, flu vaccine, the majority of it now is preservative free. Any vaccine for a kid does not have any preservatives in it. There's actually high dose vaccine for adults 65 and older, because like we talked about, they're the ones that seem to have the most consequences from influenza. So make sure that you talk with your provider, whether it's a nurse practitioner like myself, your physician. Do your research, ask questions. That's what we're here for. But,
in addition to the vaccine, what are some steps or some preventative measures that the community can be mindful of and take in their home, in their places of worship, in their places of work? What are some additional steps that can be taken to prevent or ward this?
So first and foremost, if you don't feel well, stay home. If you're coughing or if you've had fever in the last 24 hours, you are contagious, whether that's with the flu, a common cold, COVID, anything. Stay home until you're feeling better. That way you're not spreading your germs to someone else. I mean, it may just be a cold to you, but then someone, a child under 2 gets really sick and ends up in the hospital, or someone with lupus who's on medication that suppresses their immune system ends up in the hospital. Wash your hands, wash your hands, wash your hands. If you're coughing, cover your mouth, those things. But those are really the 4 things. Get vaccinated, wash your hands, stay home if you're not feeling well, cover your mouth when you cough.
Sounds good. Now, do you think we should be in a season of like back to wearing masks? I know you said the flu normally breaks out around about the winter, with us approaching, spring or fall. How imperative is it now? Do we rather be proactive or we deal with it in real time?
Correct. So flu season starts typically November through March-ish. So the best time to get vaccinated is September, October, that way. Because remember, it's not like you get the vaccine today and tomorrow I'm protected. It takes your immune system a couple of weeks to create those antibodies. I would say if you're sick and you have to go out and you're coughing, wear a mask, more to protect other people. But other than that, if you are feeling okay, if you want to wear a mask, you can. But really, if you're sick, you really should, just to protect those around you. But if you're not ill, you don't need to wear a mask.
Wonderful. Understood. It's a lot of great information, so we thank you for that. Let's see, I know a lot of times when we do ask the doctor, age does come up. So we have the 65 and over population, the under 2 population, but in so many different areas of health, seems like smoking is a factor, or drinking is a factor, or sometimes your extracurricular activities are a factor.
Correct.
What are some contributing factors to the flu virus itself?
So, of course, any underlying chronic health condition that can cause inflammation or your body to be working a little bit harder. So like diabetes, high blood pressure, smoking, drinking, those things tend to stress your immune system. And so that makes you more vulnerable, and then also makes you more vulnerable for complications. Influenza can cause pneumonia and, trouble breathing. And that's how people end up in the hospital and very sick.
So there's a lot to consider, community. We have to be wise. We have to be protected. Wash your hands. Get the vaccine. And let's take care of ourselves. Sometimes we're out and we're about and we're just living our everyday life, and we don't think about the consequences of the interactions that we're having in the general public, but we want to remain protected. Wash your hands. Be mindful of those that are around you. If grandmother is in your home, be careful. Wear the mask if you have the cough, is what I'm taking out from this conversation. I'm hoping that you're getting something out of it as well. Now, is there anything else that you would like to share with us?
Well, and you brought up a good point about grandma. So if you have friends who want to come by and visit and they're like, oh, I just have allergies. If you have grandma at home or someone who's at a higher risk of having complications, just say, hey, you know what? Wait until you're feeling a little bit better. Be a little overcautious, because I don't think people intend to get other people sick. And sometimes what feels like allergies to you could actually be something else. So, just be mindful when you're visiting others too.
Y'all heard that? She said, stay home. Stay home. We have to be mindful. We have to be considerate. There's a lot of good tips and bits going on here. I'm grateful for this information. I have to be honest. I can't tell you the last time I had the flu vaccine. I think it's been a while. However, with this information, it brings it back to the forefront. Sometimes you just get so busy to think about it. It's not part of everyday life, so you just go on about. But it's something to be mindful of, especially with that season approaching, and take care of it in advance so it has time to produce those antibiotics and be protected during that season.
Yes, and the good news now is, I would always encourage you to have routine visits with your healthcare provider, but also pharmacies, Walgreens, CVS, Publix, local pharmacies have the flu vaccine. You can make an appointment there and get them there if that's more convenient. Sometimes they're open late or on weekends when offices aren't. Florida Community Health, we have flu vaccine for 6 months and up. All of the vaccine we have in our offices is preservative free if that's a concern for people.
Wonderful. So there's no excuse, guys. We can get it in the office. We can get it out of the office. CVS, Walgreens, and there are even weekend hours and after 5 p.m. hours for all of our employed individuals that want to remain safe in the upcoming flu season. We talked about how terrible it can impact the older population or the at-risk population, but how detrimental could it be to our toddlers, our babies? I know you said you had vaccinations starting at about 6-month-old,
Yes.
but what are we looking for? What happens if a 6-month-old catches the flu virus?
So younger kids under 2 tend to have a more robust response, I guess, when they get sick. You know, you could have a cold and your baby gets sick and they have like 102 fever, right? And you're like, it can't be from me. It's not the same. It is. So kids under 2 have high fever. I've seen kids with influenza 104, 105. They're miserable.
Goodness, yeah.
Their throat hurts. They don't want to eat. They don't want to drink. You're trying to get medicine in them. Sometimes they're vomiting. They're just miserable. And then unfortunately, you're going to get sick too, because as parents, as caregivers, we're holding that baby who's coughing in your face and, you know, sneezing on you. And then older kids are going to get sick. And it's not, you know, yes, you may feel bad for a couple of days, but it's the missed school, the missed work, you know, time out of daycare. You know, that's hard on some families. It's hard for parents to care for multiple children who get sick, because we all know one gets sick and then a few days later another one, and it just goes through the whole house.
Right,
yes.
Correct. So let me ask you this question, because this comes to mind. Now, after we get the children vaccinated, after we, the adults, become vaccinated prior to the influenza season, what are some measures we can take in our home? Are we still just using aerosol can disinfectants? Are we wiping down regularly with Lysol? Like, what are some additional preventative measures outside of hand washing that we can be mindful of?
Right. So if no one at home is sick, you don't have to, you know, disinfect. But if you have someone who is, you know, little kids cough and hack everywhere and they don't cover their mouth. So, you know, just trying to keep surfaces clean, wiping stuff down that they come in contact with. If your little one's sick, don't let them go visit grandma or have little play date with other kids.
What are some things that the average person just does not know? What is something that we haven't touched on that the community needs to know about, irregardless of age, irregardless of vulnerabilities, that we just aren't informed about or mindful of when it comes to the flu itself or the vaccine, either?
So I think everyone hears, and I touched on this briefly, the flu, you're just sick for a few days and then you're better, but it's not. The financial impact that influenza has every year on missed days at work, missed days in school, you know, not everyone has a lot of time has sick time even included as a benefit in their job, you know, and then if they don't go to work, then, you know,
things go downhill quickly.
Exactly. And so it's not just, it's just a cold. It's, you know, and the best thing about, you know, vaccinations is we can prevent some of that. Vaccines do work. They keep you from getting sick or as sick as you would get if you weren't vaccinated. So unvaccinated people, if they're exposed to the flu, they're going to get sick and probably for longer. Whereas if you're vaccinated, maybe the flu vaccine wasn't a perfect match, but your body has some memory of it. And so maybe you'll just get a runny nose and a cough and you'll feel bad for a day and then you're able to go back to work. Maybe no one else at home gets sick, or if they do and they're vaccinated, same thing. You got the sniffles for a few days. So I think you have to focus on prevention, you know, where you can, because some things you can't prevent, but where you can, we gotta try.
Sounds good, and it sounds like the vaccine suppresses the severity of what it could be.
Yes, you're less likely to need hospitalization. You're less likely to be sick for, you know, some people with the flu can have a fever for 7 days. It's miserable. You know, people with influenza or who have been vaccinated sometimes.
So I have a question.
Sick for a couple of days. Yes, sir.
So from your professional standpoint on the flu and the people's opinion of the flu, would you say that the flu still kills people?
Absolutely. Influenza does kill people every year.
So to the people that doubt the vaccine and how much it works from your professional experience. Could you give us an example of having the vaccine versus not having the vaccine? For some people have to be coerced into, sometimes into, especially when it comes to shots. And after COVID, the many people,
Right.
So, that's kind of still floating around, especially after COVID.
Right.
It wasn't that big before, but after it, everyone was you still have naysayers and things of that sort. So I just want your professional. So
actually, in preparation for this, I was doing some reading, and it was actually, and I don't have the statistics, but there is research that shows that since COVID, we have a lot more people saying, I don't need that flu vaccine.
Right.
And so flu vaccination rates since 2020 have dropped. And last year, it was actually the lowest percentage-wise, population-wise, across the board that received the flu vaccine. And last year was one of the worst influenza seasons on record.
So you saw the vaccines drop
because people, correct. So when less people are vaccinated, more people get sick, more people get sicker, and then they spread it. And so that's why they had said, something like 80 million people were sick last year. That's a lot. And I didn't write down all the statistics, but
that's okay. We just asking
a
professional.
lot of Yes. And so, and the vaccine, influenza vaccine works, and it works best when you get it every single year, because like we talked about earlier, it changes a little bit. And so, but that makes your immune system make antibodies that are a little bit different. And so when they get exposed to the vaccine, they have some memory, and then you're good to go.
I heard you say it changes every year. So with what's going on in the world, is that what is being equipped into it to make you that makes sense.
So the scientists actually look and track the viruses that are in circulation, and they make educated guesses. Scientists make hypotheses, right? And so an educated guess,
better than ours,
absolutely, as to what they expect will be the most prominent strains for the next year. And then the flu vaccine contains 3 or 4 of those strains that they feel are the most likely to make the most people sick. So it doesn't mean that's going to be only the ones going around, but the ones that will most likely make people sick. And so that's what they put in the flu vaccine. And sometimes, like we know with science, your hypothesis is right and it's a good match. And sometimes you learn from it and it's not as good, but it changes every year. But giving your body that boost every year has been shown to significantly decrease your risk of getting
Well, I would think that if they didn't get some of the mixtures dead on, that it'll get better as time goes.
Yes.
So I think that would be a contributing factor, as far as the flu. I've heard stories of how the flu shot have saved lives and things of that sort.
Absolutely.
So it's just sad to hear that. I kind of thought in my mind, I wonder if people are thinking less of it because of the COVID, the disparities and the people opinions of it. So that really played a part.
It did, and vaccines in general.
So what are the clinic and the practitioner nurses and things? What are they doing to try to help?
So a lot of organizations, the American Academy of Pediatrics, my organization, National Association of Pediatric Nurse Practitioners, ACOG, which is for OBGYN, American Academy of Family Practice. I mean, there's a lot of medical professionals, organizations coming out and trying to re-educate and endorse and encourage people to seek reputable sources for information, because in the world that we live in now, you can turn your phone on, look on the computer, you get information from everywhere, but anyone can put anything anywhere. And so it can be very confusing. My number one recommendation, though, is always to ask your healthcare provider. We're here to answer your questions. We are constantly learning and reading and trying to keep up too, and
we'll have the most accurate, up-to-date information.
Correct.
So as a community, how can we help to encourage people to want to get the flu vaccine as a community, not as the doctors?
Talk about it, share experiences. I think sometimes people are like, I had the flu yesterday and they're at work today. No, sir, you did not have the flu. So talking to people who have firsthand knowledge, who know what it feels like to have the flu, been hospitalized or been sick at home on the couch, with the worst headache, high fever, just feel like they can't get up. That's influenza. That's not a cold. And, sharing those stories, ask questions. Ask what other people
listen.
do,
I have a quick story. We're going to wrap this up shortly here, but I just want to give a quick story. And I'm not trying to get anything from this, but the H1N1, is it H1?
Yes.
That's what came into my home. What is that?
So
what flu is that?
I remember that was 2009 because I was pregnant with my last child.
It's a swine flu, is it called?
It was a version of influenza that it was. What made it unique is it had changed, it had mutated, if I remember correctly. That was 15 years ago. But a lot of us didn't have immunity to that particular strain, and so it was making a lot of people sick. A lot of people were dying. I remember that because I was pregnant with my youngest child, and women who are pregnant are considered high risk because pregnancy puts your body, it's a vulnerable state. And so I remember my OB being very concerned about me working as a pediatric nurse practitioner with, because there wasn't vaccine available. But that was a particularly hard year because the virus had mutated enough and a different strand. And, and so now for many years that was included in the flu vaccine or a version of that.
So real quickly, it came into my home. I think the doctor said it was the swine flu, whatever. But anyway, this was the sickest I have ever felt in my life. But I haven't, like Janie said, I haven't had a flu shot in so many years. I just want to share this story because, like you said, these stories will help.
Correct. It makes it real. Yes. It makes it real instead of something you just hear on TV or read about on social media.
So my wife got it, and then I got it, and I'm telling you, I promise you, I can't make this up. I was praying to God to please not take my life. That's how bad I was feeling.
Correct. And that's how you know you had the real flu.
Yes. Correct. It was just body aches. It wasn't I wasn't running nose. It was just body aches and headaches.
And the worst.
Yes. The worst I have ever felt.
Even after you feel better. And
this was early this year. So we have a son. God bless his soul. In March, he passed. So he received this from us taking care of him. And he couldn't do what we could do. It was so much going on. So by the time we got him, we had it for a week. She had it, and then I got it. He only had for 2 or 3 days that we know of. Right. And just that quick, we took him to the hospital. I'll never forget this. And my wife, we still mourning a little, better than before, but we took him to the hospital, and we always had this doctor. This doctor was there when he was born. Every time we took him to the hospital, I looked at him as an angel. And when we got to the hospital, if this doctor was there, I knew we were going to be okay. Right. This particular day, we get him in there, and the nurses he was having trouble breathing. So anyway, the doctor comes in there. It was a different day. The first thing he said to me and my wife was, if I were you, I'd put him on the breathing machine right now. And my wife lost it. So the reason I'm telling this story is because had we all probably had the flu vaccine, that probably wouldn't be the outcome on today. Right. I mean, we know that God makes no mistakes, and we're not going to dread on anything that has happened. But in the process, I want to say that sometimes it is probably going to come to a matter of you having a shot and not having a shot, especially if you have underlying conditions like you said, because he was cerebral palsy, he was bed, you know, he couldn't get up, walk around, he couldn't hulk out the you know, the cold that's you know, so it paid a big made a big decision on his life. And you know, so I just want to share that before we go, because it's important, like you said, to share these things when we're talking about this. You telling them this and me and us hearing it, it has to go in relation to a situation, or an event that happened. And I just wanted to share that on today. And I'll let Janie go ahead. I know we have to go ahead and close, but I'll turn it back over to Janie. But people, if you can, please get the flu shot. I think that it is very important, and because we never know what's going to come in the house.
Correct.
We never going to know when it's coming, how it's going to come. So if we're protected, then we have a better chance on the out end results. So please get yourself that flu shot. Thank you for coming, doctor. I appreciate you. And thank you for your hard work in the community. We love the clinic. My pleasure. You know, I have never met one from the clinic that doesn't like their job. And we owe you a lot of gratitude for that. So thank you. Back to Janie.
Here I am, y'all. It's Lily on the air. You're with 107.5 WJGW, the Village Radio. DJ Lee, we thank you so much for being with us. We thank you for that story, that testament to the necessary act of being vaccinated. One thing I'm taking away from this conversation with Ms. Bracero is simply this: vulnerability matters. And we don't get to gauge the people's vulnerability around us. So everybody can be mindful of first yourself and then others. Get the vaccination is what I'm taking away. We want to be here for a long time. What you can handle, perhaps your husband cannot. What I can handle, perhaps my daughter cannot. So we just want to be mindful. We want to be careful. We want to be intentional in this season. To you all, I simply say, it can cause death. But you can live.
That's right.
I'm going to pass it over to Ms. Bracero, but to you, I say live. Thank you for listening. We'll be right here again next month on the third Thursday at 1 p.m. again, and we'll ask the doctor again. Until then, Ms. Bracero, thank you so much for your time. Thank you for your education and your information, your insight on this particular matter.
Yes.
My pleasure. Thank you so much, and very well said.
Wonderful. Yeah. Radio land, Facebook land, we thank you so much. We look forward to seeing you. Let's give it up for Miss Hazel in her absence. Woo!
Yes.
You've been with WJGW, the Village Radio at 107.5 FM. If you do not have the app, I encourage you to go to your Play Store or your Apple Store and download the app. It's a wonderful thing to have, especially when you're traveling, when you're settling, when you're driving, when you're bathing.
Yes.
Download the app and you never have to miss Ask the Doctor again.
That's right.
We look forward to seeing you guys throughout the community. We're asking that you take all this information into consideration. And until then, be healthy, be happy, be whole. You are loved.